with us your journey as becoming a neurosurgeon. What exactly led you to neurosurgery, and what were the moments when you decided that I want to be a neurosurgeon?
Since when first of all, thank you so much, Aureliana, for having me here. It's great to talk to you about all the topics that we are going to discuss here in this podcast. And it's something that it's very special for me because at some point, some mentors helped me. So it's always great to help you and the other students and like medical students that are thinking, or even residents that are thinking about going into neurosurgery or functional neurosurgery. I also had some mentors that helped me, and then now it's good to talk to you and even to the medical students who are thinking about going into neurosurgery or even functional neurosurgery in the future. So even before starting my medical school, I thought about going to neurosurgery. I had this idea. I really wanted to be a surgeon when I first started my medical school. But then when I went to see neuroanatomy, it was love at first sight. So I really enjoyed learning and understanding all the lobes, all the connections in the brain, and I was very passionate about that, and it's still now it's a huge passion for me. That's why I also went to Dr. Rhoton's lab to learn more, and it's also the reason why I'm into functional neurosurgery, because I think that's a field that it's going to grow a lot into these discoveries and trying to explain what's happening in the brain and in many fields, not only movement disorders, but in many fields in functional neurosurgery. So yes, and then when I was during my medical school, I thought about that when I first I first learned about neuroanatomy. But then I also spent some time. I also did some observerships in neurosurgery. So when I was in my second year, I went. So for 3 years, I had no vacation. I was only going to visit some places, and I first went to a city here. It is called Recife. It's northeast in Brazil. They have a huge hospital there, and I spent all my month with the second year resident, because they said, oh, if you go with the second year resident, you're going to you're going to really get the feeling of how it's going to be a residency. Because I was worried. Many people would come to me and say, oh, okay, you think about neurosurgery, but at some point I think you'll change your mind. You are going into ENT, you're going into another field, you're not going into neurosurgery, because that's what's usually happening. And then I was, oh my gosh, but I'm really sure what's happening in this residency that people, they don't want to go there. And it's because it's hard, actually. The day by day, and during this month I had the feeling, because I was going there at 6 a.m. and leaving 10 p.m. and then I spent all my month doing that, and I was okay, I think I can deal with it. So at the end I was sure. And then I also went one month to Groningen in Netherlands. They had like a summer school there, and it was neurology and neurosurgery. It was a nice experience because we had people coming from all over the world, and they were into neurology or neurosurgery. And then after that, I went to Coimbra in Portugal. I spent 1 month there learning and in the neurosurgical field. So this was even before finishing my medical school. And then I finished, and I was really sure that I wanted neurosurgery, and then I did my residency. So here in Brazil, you have to do many tests in many universities and try to get into neurosurgery. And it's tough. It's very hard this time. But then I had two options at the end, but then I decided to stay here at Beneficência Portuguesa at São Paulo Hospital.
That's a long journey.
Yes.
So after you
Hmm.
got to residency, you had a mentor right away, or how it was for you?
I have some gurus that I call during my residency. Yeah, because it's, you know, you have these ideas that you want. So first I thought that I wanted to go into pediatrics neurosurgery. I really
Hmm.
want to do that. But then on my second year, during my second year, I changed my mind. So I started thinking more about spine surgery, and I really like minimally invasive spine surgery. And then I had my mentor, that's Dr. José Osvaldo de Oliveira. That is it's not it's the same surname de Oliveira, but it's the one in functional neurosurgery. And I did I trigeminal neuralgia case with him, and the patient had a really excruciating pain, like 10 out of 10. And he had zero right after the procedure, and the procedure was so fast, like 10-15 minutes, and the patient got better, and I was really impressed. And even this patient came back. It's interesting because this patient came back last year, and it's like this was in 2011. So it's 12 years with the pain, with almost no pain, but because it's never a cure, but you can treat, and then it's very mild. And still now until nowadays, he's getting the benefits from that procedure. So, and then I thought, oh, I think I want to go into that. I also did my master degrees and my PhD related to pain treatment,
Hmm.
and also biophotomodulation and biophotonics. And then I could feel how I could change the lives of the patients, improving the pain that they are feeling and improving their quality of life. And that's the reason why I thought about going into functional neurosurgery.
That's a one. Um,
Yeah.
I know you have been one of the last fellows of Dr. Rhoton, and you also known Professor de Oliveira, and you saw
Mhm.
their surgical expertise firsthand. And I wanted to ask you, what do you think sets them apart as neurosurgeons?
They were wonderful mentors and wonderful neurosurgeons. They really cared about the patients, and they really cared about education also. So it's a legacy at the end, because it's
Hmm.
not only treating your patients. And Dr. Rhoton was always telling us that he was the best mentor I ever had. He was every day going there, and even during the time that I was there, he was even sick during that time, but he
Hmm.
was still going there, and every day, and he used to say, "Oh, you are the reason why I wake up every day." And then he would go there and say, "Oh, you need to go do these and to improve and to work more and to." He used to say, "Keep working." And he also used to say, I want you to be teachers. And he really believed in us. I think that's the main thing about a good mentor. It's because sometimes they they believe in us even more than we believe in ourselves. And then this is something that's very powerful at the end, because I remember that he would say to me, "Can you see this dissection? I know that you can do better than that." Like, I imagine a wonderful dissection that you look and then you say, "Oh, that's so beautiful." And then he would look into your eyes and really mean it. He really mean it. He would say, "Can you see that? I know that you can do better than that." And that was so powerful. And then I was, "Oh my gosh, now I have to do better than that because he believes in me." And
He was
that was
pushing
very
you to the
special.
limits.
Exactly, yeah. And that was very powerful, and I'm very grateful uh, for all the help that he gave me. through the years. And even so, when I first went to talk to Dr. Rhoton, I had no idea how difficult it was to be his fellow, because
Oh.
I was there doing presenting my master degree uh, paper in a meeting in Orlando, and
Mm-hmm.
and Gainesville, it was like one hour from Orlando. And then I asked him, "Oh, can I go and visit and see your lab?" Because it was a real dream for me to go there.
Mm-hmm.
And I also wanted to talk to me because I have a cousin that he was writing a book based on his book, a question and answer book. And then I wanted to show him and also get to know the lab. And at the end, he said, "Okay, I saw that your cousin is a very hard worker. I saw that he did a great job, and I allow him to publish this book based on my book. That it's kind of the Bible in neurosurgery. Probably you saw that, the Rhoton
Yeah.
book. It's yeah, it's a wonderful
Yeah,
one.
it is.
And then at the end he said, "Oh, okay, I understood what we want for your cousin, but what do you want for you?" And then I was, "Oh, I'd love to be your fellow." So it was a real surprise. I did not expect, because I know that it was, uh, that he had a process to grow
Mm-hmm.
through and to get his fellows. And then he said, "Oh, for how long?" And then I said, I could stay 3 months with you, and then 3 months with Dr. Foot, if he accepts me, because I had sent Dr. Foot a email, but not Dr. Foot never answered. But then, and then also he said, "Oh, in 3 months you're not going to take even learn how to take pictures." And then and nowadays I know that he was it. That's true, because it's very hard to have very good quality pictures and to get to have good dissections in only 3 months.
Mm-hmm.
And then I said, "Okay, I can stay 6 months with you and 3 months with Dr. Food." And then he went and he spoke to Dr. Food, and he asked Dr. Food to talk to me on. So I was there the whole week, and then I spoke to Dr. Food on Thursday, and then he said, "Okay, I accept you, but it's very hard. It's very difficult to get to be a fellow of Dr. Rhoton. So if he accepts you, so it's easier for me to accept you, but I don't know about him. It's going to be very hard." And at the end, he accepted me. I think I was tested during the whole week, and then he said, "Oh, I know that you worked well with the fellows, and you are a good team. You are a good worker in the team." And then at the end, he accepted. I was trying to start in August, but he accepted me in October. And then but everything worked perfectly, and I'm very grateful. So the time that I arrived there in October, there was a fellow from Turkey he was starting, and he said to me, "Vanessa, I've been trying to come here for 4 years." So he was
Wow.
trying and applying and trying. And then I was, "Oh my gosh, I just came here last May and I got these." It's very, but I think the reason why was because I was there in person. Because most
Mm-hmm.
people, they just send emails. It's difficult for them to just go and talk in person. So I don't know. At the end, it was a very, very special and a very special time in my life. And with Dr. Evandro de Oliveira, during my residency here at Beneficência Portuguesa, I was seeing his surgeries. I was seeing how he was operating. He's the best surgeon I've ever seen operating. He was very precise and a very good way of thinking about it step by step. And also during the time that once I came back from Dr. Rhoton's lab, he invited me to be a coordinator here and at Beneficência Portuguesa of São Paulo. And he had a real passion about education. And even I probably that he went through ALS. the when he found out, and actually the day that he found out, maybe you were there, because I think it was like 2019. I
I
think it was
think
2000.
yeah, it was probably the first time that he just like we start discussing about this like a larger community.
Yeah, do you know? Oh, yeah, that, yeah, also in San Diego, but probably you were there in one of the course at Mayo that
Hmm.
he presented like for more than 1 hour.
No, no, I have not been
No,
here.
don't you?
Yeah, I have not been there. I know that
Okay.
the time that I was at the courses, he was supposed to present, but because of the illness, yeah,
Oh, he could not go. Okay,
yeah,
yeah, this was the last course that he went. So probably you went the next year after.
yeah.
Yeah, he got worse. But then he found out about the disease, and then he
Hmm.
just went to give his talk, and then he was presenting for more than 1 hour. I remember that at the end, everyone stand up and started clapping, but uh, no one had an idea about what was going on.
Yeah.
So I knew that because I went with him to the clinics, and also also with Dr. I think Dr. Wen was also there, and then this is something that uh, because it's very particular, and even with that, because once you have this diagnosis, it's very hard, and still after that, he was there and giving a talk, and also Dr. Talk was with us, and only we three knew about that. No, none of the students knew about that, out of the participants. And but that moment, since that moment, I admired him even more, because
Mm.
his passion about education. It's just I'm just telling this story just to so you can get the feeling
Yeah.
how passionate about education he was. So it's something that we are really trying to pass on with the courses that we have there at Mayo, and also uh, here at the Brazilian Society of Neurosurgery. So that's something very special and very powerful also.
You're very lucky you had the opportunity to meet all these
Yeah.
masters and legends in life and work with them closely. It's yeah, it's something magnificent, I think. Um, um, I would like to. I know that many women find navigating in neurosurgery more challenging because it's still a male dominant field. And I was
Mhm.
wondering if you encounter any challenges or any difficulties and how you navigated them.
Yeah, I think even during my medical school, as I mentioned, some people would say, "Oh, think you're going to change your mind during your
Mm-hmm.
medical school, and you're not going into neurosurgery." So this is this was the first uh, problem issue that I had,
Mm-hmm.
and even it was during my medical school, and it was not only one person saying that. It was uh, even friends, even close friends, would come to me
Mm-hmm.
and say, "Oh, yeah, I think you should think better. Don't do this." And I was, "Oh my gosh, but this is my dream. Why?" And this is something that you have to just think, and then really be sure
Mm-hmm.
of what you want, and then you convince them. You just say, "Okay, I don't think at the end," and I'm really sure about that. I was not going to be happy in any field in in medicine, and doing any other specialty. I was really sure that I wanted to be a neurosurgeon, and I have no doubt until nowadays that it was the best decision that I ever had, I ever did.
Mm-hmm.
And then also doing the residency, sometimes I had some problems, mainly in my first year,
Mm-hmm.
because it's like I had to prove to the team, to the other residents, and also to the faculty that I really wanted that also, and then that I was not going to give up, because I think that the main worry that they had, and this is also usual for, I think also for male, but I think that for me it was even harder because they thought, oh, okay, at some point he's going to give up. He's not going to finish the residency. And when this happens, it's something that it's harder for the, I mean, for the hospital and also for the service to work, because it's something that you are going to, other people are going to have to do the work that you were supposed to do. And then they started doing things like, okay, it's a time to put the patient on the table, and then the patient was very heavy, and then they would just disappear, everyone. It's like, okay, now Vanessa, you do this. But then I was very nice to all the people, you know, the workers, the hospital workers, and I was, please come help, please come. And everything was fine. But I just found out about that on my last year. I did not know about that. And so during my last year in my residency, and there was also one day that I would go to the ground floor and then talk to a patient and then get because we had to do some paperwork to get the patients into surgery. And then one of the faculty, he was there, and then he would send this patient to go into surgery, and then he would say, okay, go there, talk to Vanessa, and then I would go to the OR and then book the surgery. And so the patient could be operated. It was right away. It was like, okay, in 1 hour you're having your surgery. It was a very small procedure, like pain blockage, and then that was something. But and I remember that day we had 12 patients that would go into surgery, and I had a lot of work to do in all the hospital. And then, but they said, okay, you have to go downstairs and then get this paper, and then get the elevator, and then go to the 10th floor and give to the nurse so we can book the surgery. And then I would say, okay, can I go and then do all the work that I have to do, and then go back and then just get these 12 patients and then get to because it would make sense in my opinion. And then he said, no, you have to do one by one and then go downstairs, get the paper and go up. And I was okay. It felt like an office, an office person, just getting papers upstairs. But that's okay. And then because on that day that we're talking about this, they said, oh, we really tried to get you to give up about doing neurosurgery. And I was, yes? Oh, I can't remember this. And then I started thinking, what happened? Because they were, until nowadays, they are very good friends. Now it's funny to think about that, because nowadays we are very good friends. And then I asked, oh, so that day that you made me go up 12 times with that paper, were you trying to get me to just give up? And then he was, yes, I really tried. And then I was, of course not. Just because of one paper you think I'm going to give up or surgery? No, my love, it's more than that. It's bigger than that. So I just smile. But just you can get this feeling. I think they would get nervous if I would give up at some point, and I just had to prove myself. So during the second year, they just knew that I would stay. So, and then I think sometimes when you're going, I did some observerships also in Europe, in Germany, and also in US. And I think that you always have, sometimes you have that look, oh, is she good, And then you just start doing your work and then do what you need to do. And I think that's something that is getting better and better. And of course, I'm always trying to improve. And that's the thing also that I learned from Dr. Evandro. So every time that you are there in the OR doing a surgery, you have to look back and see, oh, what I could do better tomorrow. And then when you come tomorrow, you are better than yesterday, and then tomorrow you're going to improve and do even better than today. So this is something that it's very important, and I'm always trying to do that. And I think that's very, very special, that even my patients and even the doctors that are referring to me, they also feel that, and I think that's also very important.
Yes, I was about to ask you how you continue to improve when you already a master in neurosurgery. So yeah, I think you already gave me that
That's it.
answer.
Yeah, yes. And even in neuroanatomy, that because sometimes we think, oh, okay, they already showed everything in neuroanatomy, but that's not true. That's a lot to be shown yet. Maybe with the small connections, that's a
Mm-hmm.
lot that you still need. We still need to learn, and that's something that I'm always passionate about. Every time that I see that the patient is having a different outcome, and sometimes nice and good, I try, okay, what's happening here? Let's try to find out why this is happening. So
Mm-hmm.
this is something that I think anatomy explains a lot, and the connections that we have in the brain, the specific connections, explains a lot, mainly when we are dealing with the brain stimulation. So you always have to be curious, I would say, to try to learn and be humble also, because
Mm-hmm.
no one knows everything. We always need to improve and learn and try to keep learning also. So it's the way that we are going to help more patients.
Yeah, that's true. If you could give one advice to your younger self, what would it be?
Uh, I think I would say, don't be so afraid
Oh,
of,
okay.
yeah, of doing it, of going to neurosurgery, or of going and traveling and doing a fellowship and doing, because sometimes we doubt ourselves, because you
Mm-hmm.
think, oh,
Yeah.
am I going to do that right? So I tried. I think I would say, okay, try to don't be afraid. Everything is going to work it out. So just keep working hard. That everything's going to work.
um, yeah, I think that's true. You should always work and just compare yourself to your past self, not to others, and I think that will work
Mm.
out. Um, Also, do you think there is anything that can be done to encourage more women to go into neurosurgery?
I think it's good to have good examples out there. I think the way that you are also doing here is starting a conversation. I remember that during the time that I was deciding about going into neurosurgery, it was hard. It was very few until nowadays. We have
Mm-hmm.
few women in neurosurgery, but I think that with social media and this in CNS, for example, or in double as double and FNS that we had in Cape Town last year, we had a great meeting with women from all over the world talking about the process that they had, their problems, and how to solve these problems. So I think once we start a conversation, and once we get to change a little bit the idea and the mind that people might have about neurosurgery as, okay, this is only for men, it's something that it's going to help many women. It's if we think just like 100 years ago, it was very hard for women to be into medical field, and nowadays
Yeah.
it's so common. It's some in many universities it's even more than men. So I think that at some point in our surgery, it's something that it's going to be half and half. or almost that, like 40% and 60. Even in some residencies, we have that nowadays.
Yeah, I hope so.
Mm-hmm.
Yeah, for more inclusion. You're a leader in neurosurgery, and what specifically you believe that are essential qualities or skills that aspiring individuals should cultivate in themselves?
I think that once you are doing the work that I mean in societies, or even in when you have a course, for example, you always go there and do your best. I think once you have these fulfillment of doing the best that you can, and then you start inspiring other people, and then that you start getting other people to believe themselves, because I think that's also very, very important and very powerful. And that's something that I always try to do with the, the students that are working with me, the fellows and the residents, and even the neurosurgeons when they are starting, because sometimes it's it's common to doubt yourself. So this is very important, and it's also important to listen. I think this is something that is also very important when you are working with many neurosurgeons and trying to understand their egos, because it's a field that it's hard. And as a director, because I'm the communication director here in at Brazilian Society of Neurosurgery, it's something that I always have to keep in mind, and then try to be fair also with all the members in the society, and always try to do the best to get their lives better, I would say, also when you are working as a leader, because I think that once they see that you are doing your best, and it's not something, because you always need to give and not really want something back in return. It's like donate your time, donate your work, and do your best. Because I think that once you are there to help and then to be a leader, it's I don't I think that it's okay. It's something that people trusted you to do that. So you just go there and do your best. And then for 1 year, for 2 years, for the time that you are supposed to do that. And then if you do that good, in a good way, it's something that people are going to come and then give you more opportunities. So the opportunities are going to come up with this if you have these mindsets.
Mm-hmm.
So yeah, this is something that's going on right now. I'm also I'm not only the communication director of neurosurgery and of the Brazilian Society of Neurosurgery, but I'm also the first secretary in the Brazilian Society in Functional Neurosurgery. And because some people saw and really liked the work that I did during the past year and 1.5 year, they came to me and asked me to be president in 2027. So next month,
Wow.
this is very, very like
Congratulations.
spoiler, really, really spoiler. So yeah, now in April, in next month, I'm going to submit, like I'll be a candidate for president, and the election is going to be in May. So let's see.
Yeah, finger crossed.
Finger crossed. Yeah. But
Yeah.
it's for 2027. It's still a long way, but I think that it's special, and it's good to see that they like it, the work that I'm doing. I'm always going to do the best that I can, even when I'm a president. So I think that's very important.
Yes, you're really setting an example for, I think, young neurosurgeon and women in particular, because what you're doing is absolutely exceptional. And you're also in a male dominant field, you're still feminine. So this is what inspires personally me. And I'm happy for you. Congrats again.
No, thank you. Thank you. And about that, this is something that I always I always did not like that, because you don't have to. Sometimes you have to. I'm not going to say, okay, you always be okay, peace and love every time, and you have to. Sometimes you have to say, okay, I need that done, but it's something that you can explain the team, and let's do this because of that,
Hmm.
because you are dealing with lives. You have to do that right. You always have to do, and that's the mindset I try to do with the people that are working with my team in my team, because you have to treat the patient as this patient was a family member. So you are going to treat in the best way that you can when you think in that way. You're not going to let the patient waiting for 1 hour, 2 hours. You're okay. It's someone there that you love, so try to do that with that patient. And once you go to that mindset, they understand why
Hmm.
you want to things, because you are thinking that is a family member. So I just get them, okay, try to think that that person is their family member, and it's hungry and it's suffering. In the OR, we have that. We have a lot of waiting, and we have the patient that is there suffering and hungry and with pain, with some problem, and that we need to fix. And that's something that I always try to do. But it's always also important to not give up about what you are, because we are women, and that's the thing.
Yeah,
And
that's a
it's
beautiful
also
thing.
something, yeah, that's something that when I went to, and nowadays I always have my fingernails done. It's yeah, it's something that I always try to do that, and I think that's it's something that I like. But during my residency, I was not doing that because I had no time, and also it's okay. It's not that something I don't need this to survive. If I can do, I will try to. But I remember that this was a topic in one of my interviews. Can you believe it?
Oh, seriously?
Yeah. So I went to the interview. So I had my
Hmm.
fingernails done, and then one of the questions was, "Oh, so do you think that you are going to have time to do your fingers to have a yeah?" Can you believe it? And
Wow.
I was, oh my gosh, I did this because I came to the interview. I
I
don't
was
mind if I don't have
preparing.
time. But then I was, they were very mean in that interview. But then, yeah, that's something. You're always going to see people trying to diminish you and try to get you to a box that, okay, you are not going you don't you are not going to have space to be a woman, in
I
neurosurgery.
see.
Then I think that the idea that they have behind it's because it's that, but actually it's just some idea that they have that it's wrong, and maybe they don't know, and it's still nowadays I see this person in in meetings, and then I am the way that I am, and maybe nowadays, like, let's say more than 15 years after, yeah, I think like 16 years,
Mhm.
maybe nowadays he started thinking differently. I hope so.
So,
Yeah.
yeah,
Yeah.
time is changing. So, uh, and the last question, because we're running out of time, and you have recently attended Illuminati 2024. I didn't know about this. I just saw your Instagram and I saw that you have been there, and I thought it's probably something really cool. Taking like thinking about the AI and everything that it brings to the table to the neurosurgeon. What do you consider to be the most groundbreaking advancement currently in neurosurgery?
Yeah, it was a great event that we had in February last month.
Mm-hmm.
And I think that AI is something that mainly in functional neurosurgery that's going to play a very important role once we get, because in neurosurgery you have many numbers. Once
Mm-hmm.
we are getting the targets, and once we decide, oh, this patient needs to have the target in this nucleus or in that nucleus, I think at some point we're going to decide not only the nucleus, but exactly the area that we are targeting into the nucleus based on the symptom that the patient might have. Nowadays, we have an idea, and then we always try to go there. That is that kind of sweet spot inside the nucleus. But I think that at some point, we're going to have AI telling us, okay, for this patient, very personalized. For this patient, the ideal area is going to be this area in this nucleus. I think that's going to help us because they're collecting data to comparing to what we had in surgery and also what we are getting during the programming and what the benefits that the patients are getting, and also the tracks that we are stimulating to get the benefit for the patient. And so I think that with that, it's something that is going to help a lot. And the idea that they had there, because it was a event that Medtronic organized, is to get all the technology that they have to grab and get this information. So it was nice. It was mind-blowing. And it was nice to see all the areas. I was there to talk mainly about functional neurosurgery, but we also had great names in neurosurgery. Even Dr. Michael Rhoton was there, and many neurosurgeons, very important neurosurgeons from all over the world, actually, mainly from the US, but we also had Dr. Stefan Bolsberg from Austria that was there and talking about all the fibers that we have to treat brain tumors. And it was a very special and very good, and we had a very good feedback from the participants. So probably this was the first one. Probably we're going to have more coming up.
Nice.
Yeah.
Thank you so much for your time and for inspiring us. It was a really pleasure to talk to you, to see you again, and hopefully I'll see you soon.
Yeah, I hope to see you soon.